Recent studies indicate that the HIV epidemic in Kenya has stabilized in the past few years. The number of new infections, however, remains alarmingly high. Certain groups of people have been identified as having the highest risk of transmitting and acquiring the HIV virus and sexually transmitted illnesses (STIs) in the country. This is due to their increased frequency of high-risk sex, such as unprotected anal and vaginal sex, concurrent and multiple sexual partners, and drug-related HIV risk behaviours.
Sasa hizi dawa zina hatari sana. Saa zingine pengine sina pesa na nataka kuvuta. Au nataka kujidunga, manake nikivuta sisikii. Nitapata mvulana ataniambia Adija vipi na kutaka. Na ana dawa, yeye pengine muuzaji. Ataniambia tuende tukafanye mapenzi. Atanipatia dawa, atanipatia pesa ya chakula. Sasa mimi hata nikijaribu kukataa kufanya naye mapenzi na vile naumia na ile ya rosto. Yaani ya rosto huwa nasikia paka mpate ile dawa nijidunge. To ile ya rosto yangu. Sasa nikiangalia saa zingine pesa sina na nasikia rosto. Naenda kufanya naye mapenzi.
These groups, known as most at-risk populations, MARPs, include male and female sex workers and their clients, injecting drug users (IDUs), long-distance truck drivers, and men having sex with men (MSMs). According to the Kenya Modes of Transmission KMOT study conducted in the year 2008, most at-risk populations account for about a third of the new HIV infection in Kenya, with the female sex workers contributing 14%, injecting drug users 9%, and men having sex with men 10%. MARPs experience barriers to accessing services because their behaviours are criminalized and stigmatized, making them marginalized and hard to reach. Their practices are illegal and they are, in most cases, caught on the wrong side of the law. This prevents most of them from seeking health services whenever they contract infections.
Napata changamoto nyingi kupitia kwa hii kazi yangu, kama vile mambo na polisi barabarani kila mara, na pia kutokubaliwa na jamii kwa ujumla. Manake kutatokea mambo mbalimbali ambayo yananifanya mimi pia kutopata hali yangu ya kiafya inavyotakikana.
Mwaka jana nilikuwa kwenye mkao ikaa navuta. Na siku nilikuwa niko na mtoto ninamwacha nyumbani. Tukavuta hapo hivi, baada ya kuvuta nikasikia ile dawa pia inishiki, nikachukua nikajishoot, nikajidunga sindano mpaka nikalala hapo. Mapolisi wakaja wakanishika. Nikaenda jela nikakaa miezi 6, nikaacha mtoto wangu nyumbani akiwa yupata shida peke yake.
Many healthcare facilities do not offer MARPs-friendly and targeted services. Furthermore, the society is hostile to these groups, instilling fear in them. Therefore, many of them opt to remain undisclosed. These, among other reasons, make it difficult to reach them with health services.
Unaweza pata client vile mtu wako mmeelewana, ukafika kwa room ikawa sivyo. Kuna wengine hata wanakupiga. Kuna wengine hata wanakutupa nje usiku wa manane. Ama hata kwa mtaani tu. Wale ambao wanajua unafanyia kazi. Pia wanatoka katika a lot of challenges. Pia hata security yetu. Hatuna security kweli. Na hii kazi yetu imetufanya hata tusifikie vituo vya visiting.
Sisi waendeshaji tulela tuko at risk ya kupata HIV and AIDS kwa sababu tunatuanga vituo mob.
To effectively reach and address the particular needs of most at-risk populations, there is need to develop customized HIV, STI prevention, care and treatment programs.
All the practices that they engage in are actually against the law, made it very important for us within the strategic plan to try and define modalities of making sure that they access services, irrespective of whether what they were practicing was legal or not. Because it is a public health concern that men who have sex with men also have sex with women. And there's a likelihood of this actually getting to the general population. So we had to do everything possible to try and curtail the spread of HIV through these illegal, if you like, practices.
The HIV and AIDS Global Fund Round 7 GFR 7 program seeks to increase the access and utilization of non-stigmatizing health services and HIV prevention information to most at-risk populations.
Some of the strategies that the program has used to reach these categories of most at-risk populations include targeting them through their own networks and reaching out to them right up to the pockets where they are found, but also using their own people to do the mobilization, but also doing moonlighting services. Up to date, about 30,000 of these categories of people have been reached with the HIV prevention and treatment services.
The program is carried out through many implementing partners, among them Hope Worldwide Kenya, Kenya AIDS NGO Coordination CANCO, Mother's Delight Moments, among others.
We are also doing peer education training, and we have been training youth, both young men and women, and we have also trained MARPs, that is MSMs, as peer educators, and they do group outreaches and sessions with their peers, and even one-on-one where maybe a peer do not want to talk about his personal issues when everyone is there.
These interventions comprise providing HIV STI services for MARPs and their sex partners, which include behavioral components.
The Global Fund Program Round 7, it's a combination of various interventions from in areas of prevention as well as treatment services. These are in various regions as well as using diverse approaches, including HIV counselling and testing, prevention education targeted at various vulnerable groups as well as most high-risk groups, but also the general population, both male and female, girls and boys. It also seeks to engage structures at community level, regional level as well as national level.
The implementers coordinate most at-risk populations outreach events that increase awareness and knowledge of HIV risk factors and how to avoid acquiring or transmitting the virus to others in various key areas in the country. This gives MARPs assurance that they will not be a target of the law or victims of stigmatization.
We do have the Kenya National AIDS Strategic Plan 3, which Clarion Core is delivering on universal access to services for everyone, including the most at-risk populations. Moreover, our Constitution has in Section 56, subsection E, enshrined a right to health for the marginalized groups. So in Global Fund Round 7 project, we encourage them to access HIV testing and counselling and other HIV prevention services.
Preparation for a most at-risk populations outreach event begins with planning meetings. This is then followed by mobilization, which is done by peer educators. This is because they are best able to mobilize their peers to go for testing. Mobilization can be done through night or hotspot outreaches for most at-risk populations or through bar outreaches.
Nimealikwa kwenda kuhudhuria mkutano wa HIV. Naogopa, lakini nitaenda kuhudhuria tu.
During our trainings, we use the national guidelines for sex workers curriculum. We also borrow from National Life Planning Skills curriculum. Can anyone tell us why we need to know our HIV status? Yes, Jane?
Ndio tukuwe sure, sababu kujua ndio kukuwa sure.
Ndio tujue, kwa sababu kujua ndio kukuwa sure. Mwingine?
To be able to plan our future well.
Before engaging in the outreach, the facilitators need to understand and distinguish the different populations and their needs and the gender and sex-related differences within the groups. This helps them to come up with a targeted approach. Common cultural beliefs and practices related to the subject of most at-risk populations and sexuality in the community where the outreach is held, and some of the factors that expose the most at-risk populations to the risk of HIV infection are discussed during the activity. To begin with, the most at-risk populations are educated on the basics of HIV and AIDS, like modes of transmission and why they need to get counseling and testing services.
Leo niko hapa kama facilitator kutoka shirika la Kanko. Kanko ni muungano wa mashirika ambayo yanafanya mambo ya kushughulika na virusi vya ukimwi, hasa katika kitendo cha kuzuia ama prevention. Labda nani anaweza kuzungumzia ile kutumia mihadarati kwa njia ya kutumia sindano vile inaweza sababisha mtu akaweza kuambukizwa virusi vya ukimwi?
Kuna wakati mimi niko na bomba na sindano yangu na mihadarati yangu, nataka nitumie, lakini rafiki yangu hapa hana vifaa vya kutumia, ana mihadarati lakini hana bomba na sindano. Sasa kwa sababu tuko na arosto sote, mimi nitatumia bomba yangu nijidunge. Nikishamaliza kujidunga, ile bomba tunafanya tu kuisafisha na maji, nasafisha ikiwa unaona hakuna damu pale imetakata, hiyo nampatia mwenzangu, naye anatayarisha, anajidunga.
Kando na HIV peke yake, kuna maradhi mengine pia ambayo tunaweza kuambukizana kama vile hepatitis B na maradhi mengine mbalimbali. Njia nyingine
ile sindano ambayo mimi nimetumia ile dawa, nimechukua nimejidunga, naweza mbakishia mwingine vile pia akatumia ile dawa.
They also learn about common opportunistic infections that may afflict them, their prevention and control, and the socio-economic impact HIV and AIDS would have on them, their families, community, and nationally, among other issues. In addition, the outreaches empower most at-risk populations with life skills on how to cope with HIV and AIDS and any stigma this might bring in the society. These life skills include assertiveness, especially on negotiating for safe sex.
Kama utumii condom, mimi nashindwa na mambo zako. Juu sijui hali yako. Unajua mimi najua hali yangu.
Na mimi sijui shoti mimi.
Hapana. Wewe kana hizo ndugu zako. Lakini mambo ya condom ndio muhimu. Kama si hivyo, unaweza toka.
Correct and consistent condom use.
Shapata hii condom, angalia expiring dates. Ukiona iko sawa expiring dates, unaibofya kama ina pumzi. Ukiona iko poa, hakuna pumzi yote inatoka, unajua iko sawa. Alafu kuna hizi menomeno hizi ndo mahali tunaikata.
Gender-based violence.
Sina pesa yako mimi.
And alcohol and substance abuse and its effects.
Baada ya kupata mafunzo na tumepima, tukajua kila mtu hali yake. Ndio hata ukienda kwenye hiyo biashara, ukipata mtu hataki kutumia kinga, unaachana naye, anatafuta wateja wengine. Na kutembea, tunaelimishana kila mahali, sehemu mnatembea.
Nashukuru kupitia kwa mradi wa Global Funds Intervention, napata elimu ya kutosha, najua vile naweza jikinga na maambukizi ya magonjwa ya zinaa, hasa virusi vya ukimwi na mengineyo.
Mara nyingi huwa nikisikia kuna seminar ya kuhusiana na drugs abuse, hatari za madawa kulevya, huwa napenda kwenda mpate mafunzo zaidi niache. Na mara nyingi watu na ile shirika la Global Fund wala jasana likoni CDF huwa naenda kujifunza jinsi ya hatari ya madawa ya kulevya.
Ni vyema tukijua jinsi ya kujizuia kupata HIV na STI au hata wa clients kutuambukiza sisi.
These outreaches have helped in increasing access to HIV counselling and testing services, implementing HIV risk reduction measures, and lessening of stigma for male and female most at-risk populations. During the outreaches, the MARPs are also made aware of the available referral options in the community, such as health facilities.
At the river, and especially so Mulolongo is a major truck stop, and the Global Fund Round 7 has actually been targeting the MARPs. So they have also been having education sessions with the truckers and also the sex workers so that they can also have better approaches for prevention.
After attending these outreaches, some of the MARPs who are willing to reduce or completely stop the risky behaviours and adopt alternative means of livelihood appropriate to their gender are offered support.
I now have enough knowledge and it has helped me a lot. I know my status and I'm no more fearing anything. And I have also decided to open my own small business.
Tulianza kufungua kila mtu biashara, mimi nikafungua salon. Sasa venye niliendelea hivyo, nikakuwa napata pesa zangu za kutosha kusomesha watoto. Naenda siku chache huko kwa sex workers. Kwa hivyo naenda tu nikipunguza, si kama wakati wa mwanzo.
These alternative means of livelihood provide an opportunity for risk reduction. However, startup capital remains a challenge for their business projects. Those who participate in the outreaches feel more confident about taking charge of their health. They use the obtained knowledge to protect themselves and others from acquiring HIV. Through this program, strategic MARPs-friendly resource and health centers have been established to provide targeted services and support their right to health. These centers, however, require sustainable funding to facilitate access to health services. Awareness creation to the general public also remains a challenge due to the society's cultural and religious beliefs. Public awareness is key to breaking secrecy and silence, challenging wrong assumptions, clearing confusion, and motivating people to think differently. And once the public is well informed, they will contribute to stigma reduction towards the MARPs.